and then from there we can wrap up. And the day is just meant to give you an update as to what we have done as of yesterday, and also the number of cases we have, the number of tests we have done, and also highlighting on activities in the various subcommittees under the National Health Emergency Committee. So these are the information you'll be given for you to take to your various media houses. On that note, I now invite Dr. Bitte to come and give a statement. Dr. Bitte.
Good evening, once again, ladies and gentlemen. I stand before you again to give the daily update. This is the 32nd National Situation Report since the confirmation of the first case in the Gambia on the 17th of March 2020. 6 laboratory results received and all tested negative for COVID-19. Of these results, 4 are repeat tests of the active cases. So these second consecutive negative test results for each of the 4 patients are indicative of recovery from COVID-19. So it means that they are set for discharge. 5 new persons taken into quarantine, and all of these 5 are Gambians returning from Senegal via Jiboro border post. 1 person discharged from quarantine after testing negative for COVID-19 upon completion of the quarantine mandatory period. A total of 102 contacts of the recently confirmed cases are traced out of the expected total of 105. The country currently has 97 persons under quarantine, 3 active cases, and no probable case. There are no new cases recorded today. Globally, since the 31st December 2019 and as of 21st April 2020, a total of 2,553,435 cases of COVID-19 have been reported. Of these, 177,294 deaths were registered, and 688,700 recovered from the disease. Senegal has recorded 412 confirmed cases, 242 recoveries, and 5 deaths. Currently, we have 97 people in quarantine. A total of 367 tests were conducted, and 10 are positive. 265 people completed quarantine, 543 contacts traced, and 310 people completed follow-ups. So there have been daily coordination meetings and at both the strategic and the technical levels. On logistics and safety, the following activities were implemented. Assessment completed to erect an incinerator plant in one of the isolation centers. Training of security personnel in COVID-19 response begun, and distribution of donated items to regional health directors is ongoing. Regarding the next steps, the Ministry of Health will embark on the following: intensify COVID-19 sensitization campaigns, expand testing criteria to test more people from all regions in the country, strengthen the rapid response team and contact tracing teams at all regions, deploy newly hired health personnel to their duty stations, strengthen community surveillance in all regions, especially at undesignated border areas, encourage public reporting and self-reporting of suspected cases, through the toll-free line 1025. We continue to emphasize the need for everyone to strictly follow the government's guidelines and also the need to stay at home to protect our healthcare workers and to save our lives. Finally, I would thank all our partners in the fight against COVID-19. At this point, we would like to register our profound gratitude to the Gambia Chamber of Commerce and Industry for mobilizing resources for the fight against COVID-19. We would like to extend our sincere thanks to all frontline health workers, particularly those at the points of entry, quarantine, surveillance, laboratory, rapid response, case management, risk communication and community engagement, logistics and security, and contact tracing for their sacrifice and dedication to duty. On that note, we would like to thank each and every one for the efforts and sacrifice you are making in following the rules on social distancing and guidelines for preventing COVID-19. We also would like to thank our stakeholders and private partners for their support towards the fight against the novel virus. Together, we can overcome this challenge. Thank you very much for your kind attention.
That's the end of the statement. We now go into the second part of the press release, and now we invite Prince Abubakar Aminata Sankano to facilitate this particular session. Mr. Sankano.
Thank you very much, Director of Promotional Education, Mr. Modinja, who is also the leader of the Risk Communication and Community Engagement team. Thank you very much, Dr. Mustafa Bite, as usual, for the elaborate update on behalf of the Honorable Minister of Health, Dr. Ahmad Lamin Samate, who is also the chairperson of our National Health Emergency Committee. Ladies and gentlemen of the COVID-19 Media Corps, the floor is open for questions. Your name, yes, sir. Go ahead.
My name is Councilor from Star TV. Yes, I want to ask two questions. The first one is pertaining to the quarantine centers. In one of my radio programs at Star FM Radio, I was called by someone in Lulu Kebe and Lulu Chare saying that they don't have the quarantine center at that place. And 3 people out of 8 they were tested for body temperature and their temperature were high. So they were taken back to taken back to Senegal. These are 8 people from Senegal. They were taken back to Senegal because they said they don't have a quarantine center in these 2 areas, in NBR, that is Lugu Kebe and Lugu Charen. The second thing that we also saw, personally I observed, the security officers that are going to the market and other places, actually to ensure that people respect the time that is given, they are not on personal protective equipment. And then the last time I checked, police are not in it, security officers are not in it. Why are they not equipped with personal protective equipment? Okay. These are the 2 questions.
All right. Thank you very much. Dr. Vite or Mr. Manjari?
Thank you very much. That is an excellent question. With regards to the security officers going to the market to ensure that people adhere to the public emergency regulation, basically they are supposed to protect themselves, and ideally we will advise them to put on masks and any form of protecting themselves, also for them to also to move along with sanitizers. But these ones, as you know, the Minister of Interior is already part of the Public Health Emergency, National Health Emergency Committee, and as well as the Minister of Interior is also represented in the Logistic and Safety Security Subcommittee. And we will request that the heads of those institutions in the various police stations, for example, KMC, and they can send their requests through their representative in that committee for them to be able to be given some of those things when they are available at that place. And I'm sure they will be given what is required for them to have at this point in time. We don't expect them to be putting on PPEs, like, for example, jacket, overalls, and so on. But at this point in time, they can protect themselves by using masks. And then for now, and I think they can get this thing available. With regards to Ndungu Kebe and then North Bank, we had a discussion, and we are planning to have a quarantine center in that area to see one of the now assessment have been ongoing, and we got invoice from one of the hotels, and that has been forwarded, and then we're going to look at that because we also look at the factored in the transportation, like people coming from North Bank, you want to cross them to Banjul here or to maybe to one of the hotels, one of the hotels in Bakau, it might be very inconvenient. So we suggested that we have one of the hotels to be identified in North Bank to be used as a quarantine center, and that is also the discussions are already ongoing. And then the team in North Bank West, we have been asked to identify a hotel, and they've identified and they've collected the relevant invoices, and then we are now in the process of also setting up a quarantine center in that area. That's also one of the things we are working on. And those people who have been, temperatures have been assessed, vital signs have been taken, and then they realize the temperatures are high. We don't advise them to return them back. They could have just communicated with our authorities. We have our regional health team in SL. We also have our health district hospital in SL. The communication could have been reached to those people, and then they will take the necessary action. It is rather unfortunate that this has happened, but the line of communication to central level here is through the regional health directorates. And the regional health directorate, we have about 7 of them. One in SL, the headquarters is in SL. The other one is in Farafenya. You have one in Bansang, you have one in Basse, you have one in Mansakonko, one in Brikama, and one in Kanifing. So these are the regional health directors we have. So we advise the public to also liaise with those authorities, and because we have the various categories of health workers working in these various stations, regional health directors, so that they can also take their necessary action. I think Dr. Bide. Yeah, so basically this is exactly what I want to respond. But we are really concerned with the North Bank issue, and then we've already made decisions on that to have a quarantine center. Thank you.
Yeah, can I make an update? Can we get that in Wolof? So, because the program is in Wolof, please.
Comme mbokk yi li ma wax rek mooy dafa laajte woon comme que North Bank amuñ quarantine center fu ñu mooy place boo xam ne foofu la ñu war a dencee tiyaangum nit ñi ñoo xam ne dañ jógee place boo xam ne dëkk bi dafa am feebar mbaa place boo xam ne dafa am feebar mooy moom lañ jaw quarantine te bunta boobu nag ñu ngi koo sant di ko gërëm si loolu si laajte boobu te ñu ko di ko wane tamit ñun de pare nañ pour gis ne daal ñi nekk waa North Bank boore ñu ngi caareen ñu ngi Kébé yooyu ak waa suma aide sa North Bank so loolu yëpp daal li ñoo plan mooy ñu gis ne kenn mënutaa jaala ñëw ku ñu war a yóbbu quarantine waru nañoo jaala ñëw ba fii waaye dañ na bëgg a def fu mu nekk ne suñu team bi nekk foofu mooy SEW regional health director ñoom already seet nañ place benn hôtel seet dem nañ foofu te jox nañu invoice fu mu nekk ne ñu ngi seet pour ñu gis ne ñu mun a yóbbu nit ñi foofu fu mu war a nekk mu war a nekk quarantine centre pour ñu gis ne coono bu war a nekk si nit ñi pour war na laa jëne ba fële islam ba fii coono boobu lañ bëgg a wàññi si nit ñi loolu nag fu mu nekk ne bàyyi nañ ko xel te ñu ngi ko def te buntu yow gëram ak ñu war a toogee ba daanaka nañ si bàyyi xel wax na tamit ne police yi de dugga si marché bi di laaj nii o di wax nit ñi di pour time bi jot na pour ñu war a dellu ñu war a génn si marché bi ñoom na amuñ plat bagage ne loolu lañ war a dimbale seen bopp pour ñu mun a aar feebar bi dama ko wax ne li ma ko tontuwee mooy ñooñu nag nekku na dañu la expect na dañoo am ay overall yu mag yooyu loo xam ne loolu lañ docteur yow day war a sol pour ñu nekk si treatment center li ñu war a sol déedéet ñoom ne fu mu nekk ne ñooñu mun nañoo am ay masque moom lañ mun nañoo sol su nekkee amuñ masque xam nañ ne police muy ministre of interior dañ jee toog si comité bu mag bi mooy bu nekk covid 19 comité bu mag bi te am nañ tamit ne dañ jee toog tamit si comité bu ndaw bi bu ñëw waa logistique and security te ñu su nekkee police station bu nekk dañuy gis ne daal dañ solo dara ñoom mun nañoo officer commande yooyu ñoom dañ mun nañoo communiquer si seen comité ak kenn ki si ñoom mooy jok mooy kuy represent mooy DO division officer Masane Fofana moom mu fa dee toog ci wàllu sécurité mun nañ koo contact mbaa nga am captain corps ñaar yooyu nag soo leen communiquer rek ñoom dinañ seet nga request bi su ñëwee chairman comité bi sax moom moo nekk logistique and security committee moom Baba ni Sabay la nekk suñ bindee request bi su seen representative mooy ay da police mbaa mu nekk ami ñoom request boobu su demee dafa dem si chairman mu seet ndax ñooñu ne am na ñu war a am ñu mooy naa dimbale waaye buñ séntu ne dañoo am bagage boo xam ne ñooñu la docteur yi war a sol su nekkee dañ nekk si lopitaan boo xam ne foofu la ñoo faje ñii loolu nag lañ ko bëgg a max rek moom boobu na war a baax te ñu mun a xam ne tam ñu bàyyi seen xel rek ba léegi suñoo wax nit ñi ñu génn buñ leen jegeeñ bu baax ba léegi ñu xam ne diggante dañ leen war a bàyyi seen diggante benn mètre mbaa ñaari mètre boobu dafa war a nekk loo xam ne dañ si war a bàyyi xel te ñoom seen bopp suñoo liggéey te suñoo dugga si marché bi nañ gis ne tam suñoo dugga si marché bi police yi fa dee dugga nañ gis ne daal raxas nañ seen loxo ndox ak saabu toujours bala ñoo dugg si marché bi te suñu ñu bàyyi xel tamit buñ laal lu bagage yu bari si biir marché bi lu ñoo def la mooy ñu dugg si liggéey marché bi liggéey def seen liggéey après su gars yi pare rek ñu gis ne daa masque am na pour ñu aar seen boppa lii la am pour tontu la jërëjëf.
Thank you. Just another update. And this morning when I was coming from Bruceby to traffic light, I think gradually the police are getting at least the face masks. They were wearing blue face masks, at least the traffic. So I think that is going on. Yeah, you have...
I have a follow-up.
Yeah, go ahead, sir.
Based on the answer from this guy's question regarding the quarantine centers in this part of North Bank,
Yeah.
one may assume that it's a weakness in terms of in the side of the health ministry, putting at the back of your mind that such a community is basically bordered with Senegal, having no quarantine centers at such a strategic location. And on a daily basis, I believe we are being briefed here that centers have been allocated right across the country. Why this one?
Okay, before I come in, I'll leave the director to explain.
Thank you very much. That was a very good question. What happened is, like we made it very clear some time ago, that we are working to get fully functional, operational quarantine centers in all the regions. Some areas we are working on to getting the land so that construction can begin. But for ESA, what happened is it was difficult for us to get a place that we have been discussing with the hotel owners. As you know, when people talk about Corona, nobody wants your hotel to be, to be used as a center for quarantine. So it was difficult and then based on those negotiations, we were able to identify one, and that's what currently, and we had to go in for that one. That was why, but it doesn't mean that we didn't put it into consideration. We put it into consideration, and we were doing our assessment, and it was difficult for us to get it at that point in time. And also, we make sure that we made the movement very easy also, so that those who are also supposed to be quarantined from that end, they are easily moved from that end to the quarantine center here without any hindrance. But we feel also that the movement also might be too much, and that's why we said there is a need for us to have a quarantine center in the North Bank, and especially North Bank West. And the same thing applies to North Bank East, where we have also been able to identify through the regional health directorate to be able to identify quarantine center, and which they've also done, and they've also identified a place for us, and we are working to operationalize those areas. So exactly. You might think it's not a weakness per se, but it's something that we couldn't get. And even at the beginning, to get hotels here in the Greater Banjul area was a challenge. Not every hotel owner would like to give your hotel to be a quarantine center. That has been a challenge for us. I think this needs to be understood, and we really emphasize on this on several occasions. Thank you.
Thank you very much, Mr. Kante. I don't think we would like to reach a level where we have to use your OB van as an ambulance to quarantine victims. No, I'm just, well.
We've said that land, looking for land, if we don't have hotels or lodging to use as a quarantine center, land issue for them to build a temporary structure. Is he trying to tell us that the ministry cannot communicate other line ministries who have thousands of hectares of land which are government properties that could be used for such? And after that one.
No, can I respond to that one?
Currently, average Gambians in those environments, life are at risk. Can you give us a deadline of such a thing in relation to we have collected invoices? Maybe tomorrow someone can enter there with Corona. Are we going to wait for next week for the invoice to be approved, then the particular location to be used? We need, in terms of days or whatever.
Thank you very much. At this point in time, we cannot give a deadline. That one is just very clear. I know if I should give a deadline today, tomorrow you come back to me and say you said this. So we are very careful with deadline. I'm not going to give you a deadline as far as we are concerned. What I can tell you, I said land for areas like Basse. We already have a quarantine center. That's one of the hotels. We are using that, and also negotiations are also ongoing to have land, and which I'm sure it has also been secured, and then now arrangements are done now on the way now to get and a permanent structure for quarantine center. That's what I'm talking about. Where we need permanent structures, we are looking for land, and when all those negotiations are already ongoing, our regional directors are working very hard with the regional governors to get these facilities available. And if they are available, now we're going to mobilize the necessary resources to get the permanent structures in this area. But for deadline, I'm not going to give it. I remember yesterday you pushed me to a corner to give a deadline about finance, and today I can even tell you about the financial expenditure because listening to what the Minister of Finance presented at National Assembly. So you can see that we don't want to give a deadline because we know journalists, when we give a deadline, you come back to me and say, but you said this. So we are very careful. But we will tell you, we are assuring you that those places will be operational when we have people that are supposed to be there in those facilities. We are just waiting. Any case that comes now, we are assuring you that SA will be used and Farafenni will be used as of today. Thank you.
Thank you very much. As we say in German, jeder Krise is a chance. Every crisis is a chance for us to revamp our health system, our economy. I mean, our response to the COVID-19 pandemic is a learning curve. We are learning to improve a lot of things, and we hope that, the next pandemic will make us more prepared. The preparedness towards Ebola has helped us a great deal, and that's why, we are better. Any additional question? Yes?
Regarding the activities or measures taken to avoid this coronavirus, what's in our kind is respected, but the social distance is problem, especially when it comes to the Vara and Banjul ferry. You're forced to wash your hands, but the social distance issue is not well respected over there. So what is the ministry itself doing, or strictly measures put in place for the Banjul Vara ferry? Because measures have been taken for the public vehicles and transportation.
Can I say something?
Thank you very much. That's a very important question. And first of all, we have to thank the Minister of Interior and the Minister of Defense. You've seen what is happening at the Denton Bridge. When you are crossing there now, they must have to see the number of people who are in that vehicle, for example. The same thing will apply to the ferry. We are gradually will be there, and then there will be a time even when you go to the ferry, arrangements are on the way. Ministry will work with the various partners like Minister of Interior, Minister of Defense to ensure that people getting in and out of the ferry will be monitored and be made sure that the right thing will be done, and then they will make sure everybody will respect the social distancing regulation. I think that's something that is a challenge. I mean, but we're still working very hard, and then that when policies come, when regulations are passed, very few will adhere to it, the rest will not adhere to it. But now, as we move on gradually, now we are into enforcement. We have been talking, and we will go into enforcement. And we are very soon, when we go into enforcement, again, it is you people again who will come and talk and say, the laws are too stiff, that and that. So we are very, but we want to take the gradual process so that nobody will say we've not been communicated before you apply the laws. So that's what we are on. I'm just coming. Yeah, so what is happening, like, we will do something about that, and then the team will work very closely with our partner, Minister of Health, Minister of Interior, and Minister of Defense. We'll work together with the Gambia Ferry Services, Gambia Ports Authority, to ensure that the regulations are fully adhered to.
You say as time goes on, this is an emergency issue. You never know exactly what is happening right now at the ferry. So this is something like, it's a question of what exactly is the ministry doing right now to make sure that something will not happen there, like the spread of the virus. It's a board, like you never know who's in the ferry.
That's true. Actually, we will do something about it, inshallah. We will do something about it. Thank you.
Thank you very much. The good thing is that GPA and ferries are public institutions, so I mean, talking to them to improve will be easier than the ordinary people who will insist on going to Ngenti and naming ceremony in hiding. Additional question? No, give chance to others, man. You've been asking, give chance to the lady, huh? You want to ask something? Yes, go ahead, give chance. You've been asking. Give chance, tomorrow you can ask, huh?
But I will start by giving a disclaimer that I am well aware about the ethical concerns and respect to patients' privacy. Over the weekend, we had a couple of interviews with one of the family members of the patient that is going under treatment by the name Hadi Baji. According to Hadi and her family, after being released from the quarantine center, she was called at the PIU to another test, which she felt was so painful that she is not willing to do it. And later on, she was called for another second test, which she also refused to to accept. And then she was threatened by the officer that is attending her. If she doesn't comply, he is going to report that she is positive. So my questions are, was Hadi ever tested? If yes, at what stage? And what is your reaction to the allegation of the family that she was, the officer threatened her to report that she has COVID-19 when her test was never completed?
Thank you. You want to say, oh, Dr. Bide, you want to say something?
Thank you.
Oh, thank you very much. I was listening to the questions. So I think for the stage at which the said person, I think like you said, it's very good here we talk about issues and address issues than looking into personalities and individual people. But what you've raised, they are important to us, and we'll try to see how to address them. For the batch you are talking about, when it happened, we said that they were under quarantine for a time, and then they were allowed to go home. And what warranted that, as we explained in our earlier briefings, was that the decision to start testing everybody in quarantine took some time. And so when we made that decision, it happened that some of them were discharged. So they were called again. So it means that decision was taken in retrospect for those who were in quarantine. So they were called again and brought and then tested. So I just want to answer the first part of your question, which says at what stage was it tested. So that means after they've come from international travel, they've done their quarantine bit, and then they were sent home. But then a decision was made as to now we have to test those people on quarantine. Then they were among the people called back, and that's the stage at which the test was done. So as to the threats, for us, we know that the people doing this are all health personnel. They are highly trained, they are ethical. What you've mentioned is grossly unethical, and it cannot be condoned. We don't expect our trained health personnel to do that. But if we have information and evidence that they are done, then we look into it and make sure that the full law of the law is applied to the letter, because we will not condone. We are here to serve the public. We are not here to give threats. We are not here to bully. But sometimes we use force, because if we want to do the test, for example, at all costs, and you refuse, then we apply the law. We are given powers. But we have to always be within the laws, and the law does not allow us to threat anyone, to give people threats like those you've mentioned, to tell you that we are going to lie about your test. That's unethical. We cannot lie about anybody's test.
But
Thank you.
my questions are, because according to Hadi and her family, she never complied to do those tests. So was Hadi tested? If yes, at what stage? And what is your reaction to the allegation? Because they totally denied that she was never tested before that man, before your ministry announcing that she's positive. So the question is whether she was tested, at what stage, and what can you tell us about their allegation?
So I think we are telling you clearly that we've tested her, and this was her results. We are not faking any results. It's not. We don't have any benefit in doing that. So we've told you that this is what happened. She came back. Some people, I don't want to talk about people, but some people did not agree to it, and the law was used. They were tested, and we got the results, and this is what we said. And so we are giving you updates about those results. So it's not like we will come to the public and tell you something that we will fake. For what? We will not do that. Thank you.
Yeah, well, and then I think a recommendation is made that, if patients, have access to your results, so which is verified. Anyway, one final question sir.
My question is with regards to Mr. Ide's statement. Ide said that 4 among the 7 are tested and they are set discharge. We want to know when exactly those 4 discharged. Are they waiting for the weekend? As because the people say that you announce the results, you discharge the weekends. Are you still waiting for the weekends?
So thank you. So those people are 4 out of the 6 who are admitted, out of the 7 who are active. 6 of them, we reported that they had their test, but actually we got 4 results, and they are all negative. So today I was discussing with the head of the case management as to when they are going, and he was telling me that very soon. So probably they are going home today. I'm not sure if they are still there, but the tests are negative. So they have 2 consecutive tests which are negative. So it means that now they are set to go home. So they could have, maybe they are already at home, because I discussed with the head of the case management and he said they are not going to stay long. They will be discharged soon. Thank you.
The floor is closer. Tomorrow you can ask. You've dominated the question today. Tomorrow they are. Ladies and gentlemen, should I?
In relation to this statement,
Well, it's still.
he made
Okay.
in his statement that testing will be conducted with thermometers sort of in public places and things like that. So, can you tell us how soon will that begin? So as it will be, you could use the media as a marketing tool for them to be aware that on so next week such thing will be enforced.
Thank you very much about the plan.
So thank you very much. For the testing, we are not really talking about the temperature measurements and all. We said that we'll be expanding on the testing. So what we mean by that is that currently, our case definition it's not very broad. It's just international standards. So now we want to be more progressive. So we want to see how we can test more people who don't even fit the case definition. So that's what we are working on. Yesterday we had a presentation with the surveillance and WHO to widen the test, the case definition. Like now, you have to, maybe if you have a history of traveling from a hotspot and you come to the country, you have cough or fever or one of these respiratory symptoms, then you'll be taken for testing. We want to broaden that to say many other people will be tested, like those with respiratory symptoms, even if they don't have any travel history or any contact with any person. So that's what we are looking at. And so there are different strategies being profiled, and some of the strategies are whether we should have testing centers in different facilities and people can walk in, or the modalities are being worked out as to how that should happen. But this is just an information for people to know, the general public, that these are our plans, and maybe in the very near future we will be coming to tell you, come out and do some more testing in these areas or in these villages or in this particular place, so that people will comply. Thank you.
So what yesterday the minister said during the presentation ceremony, with those hundreds of thermometers being donated, he said the ministry anytime soon will start testing this temperature at public places. How soon will such go into effect? Is it that you don't have enough of some of these basic things that could be used? Because today you go to certain mini markets in the country, if you are entering, they use such a thing. Is it that such the thermometers are not effective, or what? Or you don't have enough? Why such is not in place up till now? We are more than a month after Gambia registered its fourth case.
So a good question. I'm talking about the testing we are talking about in the statement. This is what it refers to. It did not refer to testing with thermometers and all the other areas. So I know that in the thermometer testing temperature, many people are doing it. I know that occasionally we are called in certain areas, and then the public health officers go there and do testing. Maybe the scale may not be visible to everyone, but as we get more, it will be more available everywhere. But as of now, these thermometers, we have a limited number. It's not like we have like other thermometers, because they are restricted there, and the availability is not that much compared to what the other thermometers you see that they use, because those ones you can get it in every pharmacy. But this one is not like in every pharmacy you can get it, and procurement is being done about them. So far we have a lot of them distributed in all facilities. We have some more given, and I know that the public health officers once a while go and do this public testing. for temperatures and all. And we give some institutions, like many other security firms have requested, so that they can do testing at their places. So it's encouraged, and I think the scale is not that big yet in the whole country, but as we get more, it will be more visible. But the testing we are referring to is what I explained earlier in the statement. Thank you.
Thank you very much, Mr. Kant. You like giving us deadlines and dates. We are also very careful. I think if you have no additional question, we wrap up for the day. Thank you very much, Dr. Bite, for that elaborate intervention. And as usual, our chairman of the Risk Communication and Community Engagement Subcommittee, Mr. Modunjai, Director of Health Education and Promotion. Thank you very much for that explanation. Ladies and gentlemen of the COVID-19 family, all the coronials, thank you all for another interactive day. We enjoy it. We like the questions. It helps us improve. And thank you very much. And then see you tomorrow.
Love like fire. Wow. Love like fire. Xam ngeen rek affaire bi xam ngeen fan la? Kerr la 2020 lañ wax de. Waaw. Fii nag mooy Kerr fan, Kerr zero tache. Perfect skin. Skincare saa su ne rek niñ ko dee defee rek loo lañ soxlaati rek maanaam bu ngeen am problème ci seen skin yéen xam ngeen fan la fii ngeen di ñëw suma xarit yeeg am di jàmm yi nga xam ne taas daf lañ sonaloon xam nga doon xeesal ba la ka xum éneew ma lañ ko nag waaye just in case comme ni ko gars yi defee rek en cas just in case loolu xew xam ngeen fi ngeen di ñëw Skincare Plus si baax rek la ñoo dox nag ay baax rek fu ne la ñoo dem ci réew mi di lañ indi rek nag products yu baax du Paris du Italie du USA du fi mu nekk nii sax boole nañ ci nag Sweden fu nekk lañ leen a indilee products bu dee tamit nag da nga ñuul rek ñu lay jamaa natural beauty that melanin dripping we do have stuff for you as well emuñ si skincare products rek ñu ngi ci cuub yi tamit fu ne la ñoo jaar in fact sax last commercial bi ñu defoon waxuñ leen woon ne dañoo dox ci ay kawar 9A grade rek nag waaw we do have bundles as well hair si lu ne la ñoo dox ñu ngi ci rafetal jigéen rek luy taaral jigéen rek waaw boo leen di tukki tamit bëggoon rek classic suitcase ñu dañoo dox ci ay Samsonite duñ dee indi any brand of suitcases though other than Samsonite comme li ma dee wax rek boo eggee airport dëri Samsonite dafa am nuñ laa xoolee waaw ngeen de lan nag waaw skin ci moom la ñu gën a xamee nag skincare products ci moom la ñu gën a xamee ñu ngi dox tamit bentee tamit si ay dàlla man nag skincare mooy suma specialty xam nga rek jigéen bu sa xar kanam réglé loo def mu jag am nañ Patricia Reiner Kiwi Eye the whole range Lighten Up Gold Tomatine I mean the list can just go on and on and on and on lépp loo xam ne rek luy taaral jigéen la ci yooyu rek la ñoo dox Skincare Plus nag emuñ si Gambia rek ñu ngi United States ñu ngi Gambia fii ba pare bu dee yaa ngi anywhere in Europe mun nañ la ko mail within 3 days rek ñetti fan rek nga jot say diw emuñ si loolu rek dañ laa consult tamit balaa ñu laa jaay diw dinañ def a free consultation pour wax la rek exactly li nga xam ne moo méngoo ak sa kanam dinañ leen wax tamit ne rek am nañ perfumes fragrances men's shirts accessories we do dresses as well we do blouses I mean we do shoes name it we do them Skincare Plus 2020 is our year of perfection zero task fu nekk nii réew mi fii kenn waratu fi task kenn waratu fi am problème kanam kenn waratu fi am problème picture boo ko amee dafa fekk ne rek ñëwuloo ci place bi fii
love like fire bring my Love like fire.
Stewart & Co. Solicitors, a legal excellence firm in London that can help you with all aspects of your legal work. If you are looking at immigrating to the United Kingdom, Stewart & Co. can help you to set up business, buy houses in the UK, and will deal with all your legal works from start to finish.
For all your general immigration work, we can help you with that as well. If you apply for any form of visa, whether student visas, settlement visas, marriage visas, or a child wanting to come to the United Kingdom to settle with the family, we can help you to achieve your goals.
Stewart & Co. Solicitors, a legal excellence firm specializing in conveyancing, immigration, litigation, family law, personal injury, licensing, no win, no fee. Contact us today at www.sk-solicitors.com.
No, ini bara. Alright, okay. Welcome. Basically, lots of lala me along is cool, man. That I can really relax. What the madam? Yeah, that's what the madam? Yeah, what I'm doing. That's right. Grand Villa. Grand Villa. That's fine. Yes. No. Yeah, actually, a lot of people are basically me alone because they relax. So the two is that I can have this kind of Media, Nena Grand Villa is the best guest house in the Gambia.
Beji andika Grand Villa Guest House. Na labungul bebe senyaring adum na bungul bebe nyarandiring coming ibela fila ila suwe taranyame. Ntel Grand Villa na kiliano la lafino wala mukamwati ntel kang. Na ye sabati Grand Villa yela kodo nafa kalamuta.
Oh man, this is like a paradise. I know. I so much love this place. Thank you. Trust me, I love this place. You come to someone and you're watching what? Yeah. I know to Gambia. Grand Villa. I tell you. I love this place. Okay. I love this place, man. Oh yeah.
Ni lafta na kuo keso sotola. Futama Oljuntum Paradise Estate. Mbaya kumandiroke 7527-218. Wale futana website auto www.grandvillaguesthouse.com. Grand Villa Guest House.
Miss V Designer Outlet is the #1 quality and affordable stop shop for all your needs. Get your evening dresses, suit and ties, office wears for both ladies and gentlemen, beach wears, sport wears, pure leather shoes for men, quality belts, bags, heels for our beautiful ladies, original perfumes, accessories, and a lot more. Find us at Kololini Road opposite Gaddafi Mosque at the Aqua Preacher Station, or call us on 295-3411 or 764-2486. Miss B Designer Outlet. Shop right, look good.